Hi, so I'll be covering intellectual disabilities today. More specifically, I'll be going over severe intellectual disabilities in a child who is about 5 years old. So what is an intellectual disability? Intellectual disabilities used to also be called mental retardation, but in the recent years they've changed the wording on that. And that is broken down into 4 different subtypes: mild, moderate, severe, and profound. So in children with developmental delays, the doctor will perform tests to rule out other problems, including things such as hearing problems and other neurological probabilities. If no other cause can be found for the child's delays, the child will be referred to the doctors for formal testing. And so the formal tests are broken down into 3 parts, which include interviews with the parents, observation of the child, and intelligence testing. A child is considered intellectually disabled only if they have deficits in both IQ and adaptive behaviors. If only one or the other is present, the child is not considered intellectually disabled. But once you have this diagnosis, you can use it to get an IEP or IFSP for your child, which can help with things in school a lot. So once a diagnosis is made, the doctors will find the child's weaknesses as well as their strengths, and then they will use that to determine what type of supports the child needs and what type of supports the child will need for like school-wise. So what can cause intellectual disabilities? Well, those would be 4 possibilities. There's genetic, which are chromosomal abnormalities, and those are things such as Down syndrome, PKU, and Fragile X syndrome. There's also possibly health problems, such as lead poisoning, malnutrition, and meningitis. However, those normally don't cause severe intellectual disabilities. Those are usually more mild to moderate, but they're still on the list. There's also problems during pregnancy, such as substance abuse and drinking while pregnant. Those can cause things such as fetal alcohol spectrum disorders. And then there's also problems during birth, possibly such as lack of oxygen, and that can cause problems to the brain. So this having a severe intellectual disability will greatly affect the child in a lot of the areas. For example, they can still learn, but it's much more of a struggle for them. It's a lot harder, and they'll need a lot more support in school. They can learn daily routines, and they can learn some very simple self-care. Oftentimes, though, the individual still needs a lot of help with things such as getting dressed and eating. But with enough practice, they can definitely get those skills down. But for a child who's about 5, they will need a lot more help because they're still learning those skills. They will have considerable delays in cognitive development. Schoolwork will be quite a challenge for a 5-year-old. They're still learning the routines because they might be in preschool or kindergarten. So they're learning things like the school routine still. They are learning how to interact with their peers, so that will hinder them a little bit in their social skills. And they do need a lot of supervision while interacting socially. They might not always be aware of certain social norms or rules, and they have sometimes troubles with expressing themselves. Their receptive skills are okay. They can understand language, and they can understand directions as long as they're broken down and not like super complex long sentences. But it's also important to remember not to talk down to the children, because that will also hurt their feelings and be kind of rude. But you just gotta make sure what you're communicating is understandable. So one of the important things about early intervention, as we've discussed in several of the chapters in this textbook this semester, is that it can really help the children in the long run if you can help them get a leg up early on. So for children that are 3 and under, they can get an IFSP which will help with the families learning what they need to do to support the child and get them the help they need. And for children over 3, they can get an IEP. And so if you've got a diagnosis of intellectual disabilities, that is covered under IDEA's special education stuff. So the child will be able to get help with things such as speech language pathologist skills. If so, they can get help from them. They can get occupational therapy if they need it. They can get the other resources they need as far as like learning goes. So that will help them a whole lot in school. So what families can do to help these children, they can learn more about intellectual disabilities so they can know what their child needs and what to expect. They can find out what the child's learning at school so they can help practice at home. So say the child is learning how to interact with their peers, so they can teach them at home what kind of things are appropriate to do and what is not appropriate. They can work on skills such as tying shoes, putting on clothes, holding spoons and forks. So that can be also used at school for the students. And they can give them chores that can help them learn a lot of things that can work their physical motor skills, by like holding a broom and sweeping. That'll teach them responsibility, and it'll teach them a lot of good skills by giving them chores to do around the house. So there's a lot of activities that you can do to help these children promote their developmental skills. In school, there's a lot of activities to do that will help work their various domains, such as the cognitive, the physical, the social, emotional, and so on. For example, you can do games like Simon Says, because that gets them moving, it gets them following directions, and gets them interacting with their peers. At home, like I said, chores are good for them to do, as well as helping them with self-care so they can learn independence and language skills, getting them to use a lot of words, use their sentences. If they're trying to get your attention, tell them, like, use your words, and encourage them to speak and to use the correct words. Also, read with them a lot if they're learning to read, because a 5-year-old would be working on reading. Like, have them read the cereal boxes, have them read street signs when you guys are out and about. There's learning's everywhere, so there's a lot of opportunities for that for the child. And when you're in public, some things that, even normal 5-year-olds would be learning, but would be especially good to make sure you focus on with a child with severe intellectual disabilities is things like walking with the family when you're in the grocery store and not, trying to run off, because that's not very safe. Using manners, like if someone holds a door for you and your family, tell the child to say thank you. And using inside voices, kids get excited easily and they like to shout sometimes, and just teaching the child that, when we're inside, we use inside voices. When we're outside, we can use outside voices. So those are some really fun activities, I guess, to work on with the child and make them fun, make them enjoyable. You don't want the child to feel like, they're hating learning. Let's see. So in Anchorage, we have quite a variety of resources for families. The first one I think that is really, really great is the Stone Soup Group. They are a great resource for families that just might have found out their child has a disability, and so they will help you connect with other resources and other agencies, as well as help you with a variety of challenges you might be facing. Sometimes parents have a hard time understanding that their child has a disability, and Stone Soup Group is ran mostly by parents that also have children with disabilities, so they understand what it's like, and they can be there for you as support as well as for your child. So they're pretty great, and they're over there on Northern Lights, right across the street from Barnes & Noble. Then there's AARC and CISA. That's Alaska Autism Resource Center, and then Special Education Services of Alaska. They're over there on Denali, kind of by the Century 13 movie theater, and they CISA is actually a library resource, and it's a wonderful place. It's got stuff not for just autism resources, but they have things like Braille books, they have stuff for sign language, they have a lot of intellectual disability resources. It's a really, really great resource for both students, parents, and educators to check out. And I think it'd be a great resource for someone who's got a young child who is trying to like help teach them at home, because you can check stuff out and take it home for a while. It's pretty cool stuff. Then there's the Arc of Anchorage, and they're over there right across the street from UAA on Northern Lights. And they help families and individuals that have disabilities, and they help them, according to their website, lead rich and fulfilling lives, which is great because a lot of times when individuals have more severe disabilities, they sometimes, when they're adults especially, end up living in like a group home. And so the ARC really helps individuals try and stay at home if possible and help them be as independent as possible. So they're a really neat resource to check out also. Let's see. Well, that looks like that is the end of my presentation, and I hope you guys were able to learn a little bit about intellectual disabilities.